Depression is often thought of as an emotional or psychological condition, but biology, especially hormones, plays a much larger role than most people realize. Hormones are chemical messengers that regulate essential functions such as mood, sleep, metabolism, energy, and stress response. When hormone levels shift or become imbalanced, the brain and body can react in powerful ways, sometimes triggering depression or worsening existing symptoms. In this video, we will explore how hormones influence depression, which hormones are involved, and how understanding this link can lead to better mental health and treatment options. One of the most important hormones associated with the depression is cortisol, commonly known as the stress hormone. Cortisol is released when the body perceives a threat. In short bursts, it helps us stay alert and respond to danger. But chronic stress keeps cortisol levels elevated for long periods, which has damaging effects. High cortisol disrupts the balance of neurotransmitters like serotonin and dopamine, reduces the brain's ability to regulate mood, and increases inflammation. Over time, this results in fatigue, irritability, emotional numbness, and sadness. People with chronically high stress often describe feeling mentally burned out or emotionally overwhelmed. Classic early signs of stress-induced depression. When cortisol stays elevated for too long, the brain becomes exhausted and depression develops. Another major hormonal factor in depression involves serotonin, dopamine, and norepinephrine. These chemicals are often called neurotransmitters, but their regulation is heavily influenced by hormonal activity. Serotonin governs mood, impulse control, and emotional balance. Dopamine affects motivation, reward, and pleasure. Norepinephrine controls alertness and concentration. When hormonal imbalances disrupt these chemicals, individuals may experience sadness, low motivation, anxiety, or difficulty concentrating. Many antidepressant medications work by restoring balance to these neurotransmitters, showing how essential they are for emotional stability. The thyroid also plays a crucial role in depression. Thyroid hormones are to regulate metabolism, energy levels, and overall physical functioning. When thyroid hormone levels are too low, a condition known as hypothyroidism, people often experience depression-like symptoms such as fatigue, slowed thinking, weight gain, and emotional dullness. In severe cases, low thyroid function can directly trigger major depressive disorder. Hyperthyroidism, or high thyroid hormone levels, can lead to anxiety, irritability, restlessness, and mood swings. Because thyroid imbalances are common and often overlooked, many people with depression undergo thyroid testing as part of their evaluation. Women are particularly affected by hormonal changes that influence depression. Estrogen and progesterone, the two primary female hormones, fluctuate significantly during menstruation, pregnancy, postpartum, and menopause. During PMS and PMDD, premenstrual dysphoric disorder, a sharp drop in estrogen and serotonin can lead to mood changes, irritability, sadness, or anxiety. During pregnancy, hormone levels skyrocket, affecting mood and energy. After childbirth, hormone levels drop dramatically, contributing to postpartum depression. Many new mothers feel guilty or confused about their emotions, not realizing their hormonal chemistry has changed abruptly. During menopause, estrogen levels decline steadily, affecting sleep, metabolism, and emotional regulation. This hormonal shift can trigger depression in women who have never experienced it before. Men also experience hormonal changes that affect depression. Testosterone, the primary male hormone, plays a role in energy, motivation, confidence, and emotional regulation. When testosterone levels decline due to aging, stress, illness, or lifestyle, men may experience fatigue, irritability, low motivation, and depressed mood. Many men mistake these symptoms for normal aging or burnout when in reality, hormonal imbalance is contributing to emotional decline. Social expectations often prevent men from expressing vulnerability, causing them to hide or ignore depressive symptoms, which worsens their condition. Hormones also influence sleep, which has a direct impact on depression. Melatonin, the hormone that regulates sleep, becomes disrupted when cortisol levels are high or when estrogen and progesterone fluctuate. Poor sleep increases emotional instability, lowers resilience, and worsens anxiety. When sleep is disrupted night after night, depression becomes more likely. Lack of sleep weakens concentration, increases irritability, and intensifies feelings of hopelessness. Because sleep and hormones are tightly linked, improving sleep often helps stabilize hormonal patterns and emotional well-being. The HPA axis is a system involving the hypothalamus, pituitary gland, and adrenal glands, regulates stress response and hormonal activity. When this system becomes dysregulated due to chronic stress, trauma, or prolonged anxiety, the body's hormone production becomes chaotic. The brain becomes hypersensitive to stress triggers, leading to emotional reactivity, anxiety, and depressive episodes. This dysfunction is one of the clearest biological pathways connecting hormones to depression. Lifestyle factors also influence how hormones behave. Poor diet, lack of exercise, chronic lack of sleep, excessive alcohol consumption, and prolonged emotional stress all disrupt hormone production. For example, high sugar intake spikes insulin and affects cortisol regulation. Lack of exercise reduces endorphins, which naturally improve mood. Sleep deprivation disrupts melatonin and cortisol, creating emotional instability. When these lifestyle factors combine, they create a perfect storm for hormonal imbalance and depression. Understanding how hormones contribute to depression is essential for accurate diagnosis and effective treatment. Many people spend years treating depression without addressing underlying hormonal issues. Medical evaluation can reveal imbalances in thyroid hormone, cortisol patterns, testosterone, estrogen, progesterone, or other endocrine markers. Correcting these problems through medication, hormone therapy, lifestyle changes, or stress management can significantly reduce depressive symptoms. Treatment for hormone-related depression often involves a combination of approaches. Cognitive behavioral therapy can help individuals manage negative thinking and emotional responses. Medication may help balance neurotransmitters. Hormone therapy may be recommended for severe hormonal shifts such as menopause or thyroid disorders. Lifestyle adjustments, such as regular exercise, balanced nutrition, adequate sleep, stress reduction techniques, and mindfulness, support hormonal stability and emotional resilience. Some people benefit from supplements like vitamin D, omega-3 fatty acids, or magnesium, which support hormonal and neural health. It is important to understand that hormonal depression is not anyone's fault. People do not choose their hormonal fluctuations, and they cannot control them through willpower alone. Blaming oneself for feeling sad or unmotivated only deepens the emotional burden. Recognizing the biological basis of depression can bring relief and empower individuals to seek medical and emotional support. In conclusion, hormones play a powerful and often underestimated role in depression. When the body's chemical messengers fall out of balance, whether due to stress, life changes, medical conditions, or aging, the mind is deeply affected. Depression caused by hormonal changes is real, common, and treatable. With medical care, emotional support, and lifestyle improvements, individuals can restore hormonal balance and rebuild emotional well-being. Understanding the link between hormones and depression is a crucial step toward healing, and it reminds us that mental health is inseparable from physical health.